Good morning everyone. Thank you so much for watching my last video and welcome back to my channel. Today we are going to start about the medical coding modifiers. In medical coding, modifier indicates that service or procedure that has been altered by some specific circumstance but not change in it, definition or code. Basically, modifiers are two digit. Sometimes it will be the alpha, means the alphabet like A, B, C, D we can use, and sometimes it will be the numeric. Numeric means number like 1, 2, 3, 4, and the modifiers provided additional information, but it will not change the meaning or definition of any procedure or any E&M codes. In medical coding, we can find out two kind of different level in modifiers. Level 1 modifier and level 2 modifiers. Level 1 modifiers normally known as CPT modifiers, and that consist numerical digits, and it is updated annually by AMA, American Medical Association. And the examples of modifier level 1 like 25 modifier, 24 modifier, 26 modifier. And in level 2 modifier, basically it known as a HIPX modifiers that consist of alphabets and sometimes numbers. It is also updated by annually by CMS, Center for Medicare and Medicaid Services. And examples of HIPX modifiers like T1, T2, T3. Usage of modifiers. As we know that modifiers will be only the alphabets or sometimes it will be the numbers. So one more rule here applicable: whenever we are using the modifiers, it will be always suffix of the CPT procedures or E&M codes. Means we can assign the modifier after the CPT codes. So again, the modifiers are divided into two categories: E&M modifiers like 25 modifier, 57 modifier, 24 modifier. This modifier can be used only with the E&M code. E&M code means like outpatient E&M code, inpatient E&M code, observation E&M code, critical care E&M codes. This modifier cannot be used with the procedure code CPT codes. Similar to that, procedure modifiers. So these procedure modifiers can be used only with the procedures like lab testing, any surgeries like minor surgeries or might be major surgeries, any radiological examinations. So these modifiers can be used only with the procedure CPT codes. Dear friends, as we know, in medical coding we have wide range of modifiers which is divided into different categories like E&M related modifiers, radiological related modifiers, and lab testing related modifiers. So today I am going to explain about the E&M related modifiers. In medical coding, we have the three major modifiers which can be frequently using with the E&M codes. That is 25 modifiers, 24 modifier, and 57 modifiers. So what is 25 modifier? 25 modifier, it is a significant separately identifiable evolution management service by the same physician or other qualified healthcare professional on the same day of procedure or other services. So basically, modifier 25 stop the bundling of E&M visit into the procedure code. When the physician reviewing the documentation, the career should be able to determine that both E&M code and procedure code where medically necessary. As always, the documentation must support the claim that your office sent the insurance to the identify the procedure has been performed on the same day of evolution management. Let me help you with the example. A patient visits the cardiologist for an appointment complaining of occasional chest pain, discomfort during exercise. The patient has a history of hypertension and high cholesterol. The physician completes the office visit. It is determined that the patient needs a cardiovascular stress test that is performed the same day by same physician. So here you can see that the physician completed the evolution and also the same physician performed the stress test. So the physician here we need to build E&M visit as in like office visit as it is completed in the office outpatient office. So we need to assign the code series range from 9920 to 99215 and the physician same day performing a small test along with the E&M code. So for the stress test we need to assign the CPT code 93015 and we need to assign the modifier 25 to indicate that there was a separately identifiable E&M on the same day of procedures. A few rules to remember when to use modifier 25. So as per the NCCI General Coding Guidelines, modifier 25 may be appended to the E&M service reported with the minor surgical procedures. Minor surgical procedures means the procedures which having 0 to 10 days of global period. Since minor surgical procedures include pre-procedure, intra-procedure and post-procedure work, so the provider should not report additional E&M service for this work. Furthermore, medical global surgery rules prevent the reporting of separate E&M service for the work associated with the decision to perform a minor surgery procedure, whether the patient is new or established patient with the decision to perform surgery the same day or next day. So to avoid this confusion, we have some certain rules that need to be followed while assigning the modifier 25. So rule number 1, modifiers are needed to inform third party payers of circumstances that may affect the way payment is made. The modifiers tell a story of what being is done. So the first rule is applicable for all modifier, whether it is a E&M modifier or whether it is a procedure modifier. So this rule is applicable for each and every modifier. The next rule for the E&M modifier is always link the modifier to the E&M CPT codes. So dear friends, as we know, modifier 25 is designed only for the E&M CPT codes. So whenever we are assigning modifier 25, so always we need to make sure that we are assigning with the E&M CPT codes. We should not assigning with the procedure code. Okay, so moving to the next rule, it is not necessary to have two different diagnosis code. The last rule is need to document both E&M and the procedure code. So whenever we are assigning modifier 25, we need to make sure that in addition to E&M CPT, we have some other procedure CPTs, then only we can assign modifier 25 with the E&M CPT. Dear friends, these are the rules when to use modifier 25. Also, we have some rules when we should not use modifier 25. So, rule number 1, do not use modifier 25 when billing for service performed during a post-operative period if related to previous surgery. It means that if the patient has completed a surgery and during the global period he visited for the same condition, so we should not assign modifier 25 with the E&M service. The next rule is do not append modifier 25 if there is only an E&M service performed during the office visit. So suppose if any other procedure is not performed during the office visit, we should not assign E&M modifier with the E&M CPT code. Do not use modifier 25 on any E&M on the day of major 90 days global procedure is being performed. So as earlier discussed, modifier 25 can be used only for the minor surgeries that belongs to 0 to 10 days of global period. 90 days of global period, it is considered as a major surgeries. So that time we need to assign modifier 57 that we will discuss in our next video. And for the major surgeries we should not use modifier 25. The next rule is do not append modifier 25 to E&M service when a minimal procedure is performed on the same day unless the level of service can be supported as a significant separately identifiable. All the procedure have a E&M service included. For example, when a patient is scheduled to come to office for cardiovascular stress test and the physician also complete a history and perform a limited examination related to stress test, your office should only code for the stress test. The office should not assign the E&M code here. Moving to the next rule, patient came in for scheduled procedure only. So whenever the patient came only for any surgery or the procedures, then we should not assign the modifier 25 along with the E&M code. Dear friends, one last important note for you regarding the using of modifier 25. When you submit a claim to insurance that is coded with the modifier 25, you are telling that you have to pay for both E&M visit and a minor procedure. After in the past claim with both E&M procedure have been reviewed for accuracy, when you bill both codes on same day, will your documentation support? Will you have the document adequately for the E&M separately? So typically when these services have been audited, payment was rescinded due to the incorrect coding, incomplete documentation and lack of medical necessity to support both codes billed. Modifier 24. So let's start. Modifier 24, it is unrelated evolution management service by the same physician during the post-operative period. Modifier 24 is append to only E&M codes or surgical code to distinguish an unrelated e-visit that is not aftercare to procedure during the global period. A few rules to remember when using the modifier 24. Assign only to E&M levels for physician's claims, not to the surgical code. Assigned to E&M levels performed by the same physician in the postoperative period unrelated to the original procedures. A diagnosis code unrelated to surgical procedure must assign related to the E&M level. Assign if managing chemotherapy or immunosuppressive therapy during the postoperative period. Difference between modifier 25 and 24. Modifier 25 refers to the evolution management service provided to the patient on the day of surgical procedure unrelated to the procedure itself. Modifier 25 identifies the evolution management service as a unique service provided on the same day by the same medical professional. Let me help you with the clinical example for modifier 24. A surgeon performed hernia repair on May 20. The procedure has a global period of 90 days, so all related postoperative care is included in the payment of the hernia repair. But on July 1st, the patient returns to have the breast lump evolution. Report the EM level service with the modifier 24 attached and use the new diagnosis breast lump as a reason for visit. I hope you understand the guidelines for using modifier 24. Also, we have some rules where we can't use the modifier 24. Let me brief about it. Incorrect use of modifier 24. Do not assign if the ENM level is performed on the same day of surgery by the same physician. See modifier 25 guidelines in my last video. Do not assign after the post-operative period. Do not assign if the physician is a part of the practice as a physician who performed the procedure or covered surgeon. Do not assign if the complication is considered part of surgical procedure such as a post-operative ileus after GI surgery. Do not assign for the post-operative routine care or incidental service provided. Do not assign if the reason for visit is related to surgical procedures such as wound infection because it is related into the post-operative care. Do not assign if the patient requires a subsequent procedure due to surgical complications or post-operative conditions present due to the initial procedures. So, dear friends, it is a ENM related modifier. So, we can't assign to the post-operative complications, and if the patient is came to post-operative. If you need any further clarifications, please feel free to drop your queries in the comment box. I'll be very thankful and I will do my level best to deliver on your expectations. So dear friends, thank you so much for watching my videos.